welcome to this webinar on an overview of the Year 5 application for the Vulnerable Rural Hospital Assistance Program. I am Cassidy Avila with the Center for Optimizing Rural Health at Texas A&M University, and it is my pleasure to tell you a little bit more about our program today. So this is just a funding statement. CORE has a cooperative agreement with HRSA, so I've included this statement just for your reference. And today we're just going to talk a little bit about who CORE is and what we do. I'll introduce you to our team on paper. We will also go over the tiered levels of support as well as some of our resources that we make available to hospitals who become members of CORE. I will walk you through our application and give you the details of our Year 5 application, and then we'll talk a little bit about some next steps. So let's get started here. So as I mentioned, CORE is a HRSA-funded technical assistance center for rural hospitals. We offer targeted in-depth assistance to address economic challenges in rural communities that are at risk of closure, or maybe just seeking ways to ensure that they can keep care locally. Each program year, we select 30 hospitals to participate in the program. 5 hospitals receive intense technical assistance, with the remaining 25 receiving remote facilitated technical assistance. Our TA is delivered through on-site support, remote facilitated assistance, as well as self-directed access to resources and tools. We have excellent resources to draw from here at Texas A&M University, but we also pull in and collaborate with some really great resources outside of our entity, federal resources, consultants, just some really knowledgeable subject matter experts in the rural health world. And so this map is actually from our website on the homepage. If you scroll down to the bottom when you're visiting the Optimizing Rural Health website, and it displays each state that we have hospitals from that have participated in the program. So it's actually an interactive map, and if I can get it to the next slide, I'll show you what I mean. So once you hover over one of the states on the map, it will pull up a list of all of the hospitals which have participated in our program. It'll tell you the hospital name at times, the year they participated or years, and the tier at which they were participating in that year. Some hospitals choose not to be named, and that's okay. We understand. So in that case, you might see Anonymous Hospital 12 or a hospital in Texas or something like that. So this will give you a really good idea of who's participated in the past. I also want to introduce you to our team. This first page here is kind of our leadership team, if you will. I don't want to spend too much time talking about them because you can find their bios on our website and you can read about their numerous accomplishments and commitments to healthcare. But I do want to give you a brief introduction so that you have an understanding of how we're connected to healthcare, and how the team we've put together really understands healthcare, and specifically healthcare in rural America. So the head of our team is Dr. Nancy Dickey, and she is a family physician by training. And if you've had the privilege of working with her or being on a call with her, she is just an amazing resource. Angie Alanis is our associate director with over 20 years of work in rural communities addressing local issues related to access to care and the social determinants of health. Melissa Lackey is a registered nurse. She's our project specialist and a case manager for our hospitals. Andrea Brewer is our project director, and she's on all of the case manager calls. So if you have participated in our program, you have definitely seen her before. And we are also partnered with Jane Bullen, who is a nurse by training and leads our evaluation team. I am Cassidy Avila, and I handle much, of course, outreach. Kim Cassins facilitates beautifully all of our echoes, and she's also a case manager, so you likely have seen her on a call. We also bring IT expertise with Dr. Peter Yu and Julie Zhang, who support us in that capacity. Lene Hutchison is our evaluation manager, and she's a wealth of knowledge in grant writing and research, and she's used that actually to support many of our hospitals. So we have a great team ready to work with you. Okay, so let me tell you a little bit about our levels of support. So the 3 levels begin with tier 1. And as I mentioned, those are the 5 hospitals that receive on-site technical assistance. on site. Typically, it occurs at the start and the conclusion of the program year. However, COVID has impacted that, and there are hospitals who prefer to receive their technical assistance over Zoom meetings or calls, and we certainly respect that. Tier 2 is for the remaining 25 hospitals. And we don't meet with those hospitals in person. However, we hold numerous Zoom calls and phone calls throughout the program here to develop strong relationships with them. Tier 3 is self-directed technical assistance. So we won't hold the regular scheduled calls, but we will be available should you have questions or need support if you're in that tier. Tier 3 also has access to the members portal, which I'll talk a little bit about in a few slides. But that is an online portal where training content is uploaded and other tools and resources. So they'll still get access to that. Okay, so I'm going to just talk a little bit more in depth about each tier. As I mentioned, tier 1 is 5 hospitals, and they are given the option to have our team come on site at the start of the program year. We get to work with the hospitals, get to know the hospitals, the community, help them identify or ask them to identify their top priorities. We usually look for 1 to 3 priorities, since our program year is 12 months, that we could support them with during that time. We talk to them about every 4 to 6 weeks, working during those phone calls to provide resources and tools that allow them to work on the goals they've identified. And in between calls, we get updates on the goals. We talk about any roadblocks they may be experiencing, provide any additional support, and sometimes even set new goals or identify new priorities along the way. We also have mentoring through different online educational materials. We host monthly webinars on topics that all of our hospitals have identified as priorities or points of interest. Once we've selected the 30 hospitals and have the introductory meetings and learn about the priorities and stuff, then we begin to identify, if we don't already have subject matter experts, the SMEs that we can pull in to address those needs. We have the monthly echoes through Project Echo. If you are not familiar with Echo, there's a wealth of knowledge online, but it was set up clinically using telementoring. So it's a hub and a spoke model, with an academic medical center as the hub and the rural providers are the spokes. And so what they found is that this was a really efficient way to provide education where it might not be available. And so we've actually taken this model from a clinical aspect and we're using it in a C-suite format. So we follow the standard Echo format. We have a 20-minute didactic presentation. So once a month we hold these echoes and we invite all of our hospitals to attend. There is a topic for that month, and there's a 20-minute didactic presentation from one of our hospitals. There's the 20-minute didactic. One of our hospitals presents a challenge. So for example, if the topic is, swing beds, they might talk about some challenges they've had around their swing bed program and why it's not working, or what, maybe they don't know why it's not working. They're looking for some feedback. So they share their challenge, then we can open it up to the other hospitals. There's some great networking that goes on during this time. Other hospitals may suggest something that they've tried that worked, or just bring up something they tried that didn't work as, just some feedback to share. Then we circle back to the subject matter expert who shares their input and final thoughts, and hopefully something, a strategy possibly that might be helpful. So that's kind of an overview of that model. And it's a very popular type of technical assistance. We also host courses throughout the year, such as marketing, board education, strategic planning, and recruitment. Let's see. So sorry, we had a chat pop up. So those are other types of technical assistance that we're able to provide throughout the year. And we try to structure those throughout the months so that you have an opportunity to attend everything that you would like to attend. All of our courses are specifically focused on rural and offer almost 100% of the time the opportunity for direct communication with the subject matter expert that presents the course. Tier 1 also gets access to the DASH, which is the benchmarking online data capture tool for rural hospitals. And I will go into DASH a little more in a moment too. And before you start thinking that this is just a lot of resources or information, let me reassure you that we don't expect you to participate in every single thing. And we hope you participate in the things that you find useful and relevant. But we also really highly recommend that you divide and conquer. So for each webinar and course, we will give you an idea of the target audience. So your CFO doesn't necessarily have to attend the marketing course. But our webinar on revenue cycle management was probably something that would interest him. So we just suggest that you delegate and share the love. So our tier 2 group, which is our remote facilitated technical assistance, this group gets exactly the same, except the same technical assistance, except that we will not be doing on-site visits for tier 2. So we spend a lot of the time together on the phone or over a Zoom meeting so that we can understand the needs of these hospitals and what makes them unique. So everything that I just mentioned, the DASH, the courses, Project Echo, individual coaching by core team or maybe the subject matter experts, all of that's still available for tier 2. We simply do not go on site. And tier 3, so our self-directed group. And what that means is that you don't have the site visit and you don't have the monthly phone calls or classes that are scheduled, but you do have the webinars. You have anything on our website toolkit that is public facing. So the only difference in tier 3 and just the general public who go out to our website is that we know who you are and we're better able to share resources with you. Like if we have something special come up that we're able to extend to tier 3, then we know who you are and we're able to share that with you. They do get access to the members portal. And so since we've implemented that, it's been easier for us to move things to the portal and give them access that way and include them on things that are coming up. When the program is about to open the portal again and such. Let's see. Okay, so I'm going to move now into a couple of screenshots I've taken from our homepage, which is optimizingruralhealth.org. This is great if you're a visual person. So this is just our homepage, and I'm going to quickly click through a couple of these. Okay, so this is our monthly webinars landing page or our events landing page. So I had mentioned our webinars, which we host each month. We share these, we open them actually to everyone, not just our core hospitals, but we open these to anyone that would like to attend. We send out email blasts about them. We share on social media, and registration links are always on our website as well. So once we host a webinar, we also post them to the webinar library, which you can see here, and you're able to go back. Every webinar we've hosted since we started the program almost 4 years ago will be available on our website as well as our core YouTube channel. Let's see. We also have the resources, which is our toolbox, the resources page. And this is where you can find write-ups and toolkits on topics such as patient engagement, policymakers, financial opportunities, leadership, workforce resources, and things like that. So if you were to click on the first box, which is optimizing engagement with patients, you would be taken to this page, which is a page that includes write-ups and links to any past webinars that relate to engaging with patients. So you can see there are multiple write-ups here, and just depending on how hot the topic is and how relevant it is to rural hospitals determines how much you might see on these pages. So let's move along. Okay, now I have told you a little bit about the resources and technical assistance that we offer, and I went over Project Echo already a little bit. But now I'm going to touch on some of our other technical assistance in more in depth. So I mentioned Project Echo and the structure of that. So I won't go into that too detailed again, but I will just mention that if you look at the third bullet point, these are some topics that we have had subject matter experts on in the past. So cybersecurity, 340B, CARES money, CARES Act money, marketing, board education, swing beds. We've had some really, really great subject matter experts and speakers. I also do want to note, as I mentioned earlier, that we ask every hospital in the program to present one challenge during the year, during their program year. But let me say that we do everything we can to make our resources and courses as burden-free as possible. So more than once, I know that Kim has helped a hospital create their challenge presentation because they didn't have time, or maybe the individual presenting wasn't really proficient in PowerPoint, and that's okay. She jumps on the call, gets your story, takes some notes, and puts together a presentation so that you can participate in Project Echo and still get the networking and the resources and the feedback from the expert that everyone else has a chance to get. So please don't let that scare you. We want to work with you any way we can and make it as easy as possible. And up next, I'm going to tell you a little bit about some of the courses that we offer. Every year, it seems like we add a course or adjust a course to make it more relevant and meet the needs that come up that year. But here's a list of some of the courses that we held this year. I don't have links out to them because they're only available to our program participants and they're not public facing, but they are on the members portal. We do record all of our courses. And as I mentioned, almost all the time, the subject matter expert is willing to take your questions at the end of each session and sometimes even meet privately with you should you have further questions. But you'll see that we had strategic planning, marketing, recruitment for retention with 3RNet, and board education. So some of the courses are pre-recorded, so they're considered on-demand courses. And when we do that, for example, board education is now an on-demand course. And so we have 5 really amazing, high quality presentations from Jamie Orlikoff. And we schedule a call after you've had an opportunity to view all of the sessions. We schedule a one-on-one with Jamie and our hospitals. And I should rephrase that. It's Jamie and all of our hospitals together, not a one-on-one. But he gives you an opportunity to ask questions about the content or maybe something that's specifically going on with you and your board. We also invite your board to view the session and participate in the Q&A so that they have a chance to gain this education and then to pick his brain and ask him questions about the content or maybe what their role is in hospital governance. So it's a really great opportunity to get maybe content or consultation with these experts that you might not otherwise have access to for different reasons, just because of the schedule of these experts or maybe because the cost is so expensive. We also had Eide Bailly present a revenue cycle management A to Z boot camp the last couple of years. We have 2 separate sessions for these courses. We have a critical access hospital course and a PPS hospital course for the revenue cycle. And so this is a live course. It is lengthy, but this one actually does offer continuing education credits for accountants or CPAs. So they go over so much information. They talk about the Medicare program, swing bed, inpatient. They go in depth about billing, E&M guidance changes, just anything you can imagine in the revenue cycle world, they touch on in this course. So it's a really excellent opportunity. Let's see. The members portal. So the members portal is something that we just launched about a year ago and maybe 2. And so this is a way, if you look at this screen grab, you can see member on the top right. So this is our toolbar for the homepage. When you click on member, it gives you an opportunity to log in, and every hospital has a login. And I have just pulled up our tier 1 and tier 2 for our current year. And you can see that there's training, write-ups, things that maybe wouldn't go on the public facing page, such as the hospital board education FAQs with Jamie Orlikoff that I was just talking about. So if you don't have time or you missed the Q&A session where he was live, then we've got the write-up here with the redacted questions and his responses. We put special trainings on here. We put all of the echo recordings on here. We don't record the challenges that the hospitals present. We only record the 20-minute didactic from the speaker, but you can find all of those here, and then access to other course trainings as well. The Dash. Okay, the Dash is another resource that we have for our members, and we talked about it a bit, but it is quarterly benchmarking for 12 critical metrics. You can view this in live real time. We do ask, as part of your participation in our program, that you submit quarterly data to the Dash. If you share those reports with us, just in the spirit of making things as easy as possible on you, as I had said earlier, we are happy to enter them on your behalf. You can go in and enter them quarterly, but it's 12 metrics, and I can actually tell you a little bit more about what they are. I think if I go back and grab that information, but as I mentioned, part of the participation is the Dash. And so while we understand that you have a lot going on, we think that if you begin to enter data and start pulling the reports, you'll really see the value of comparing yourself to like hospitals. You're not comparing yourself to, huge system hospitals on these metrics. It's other rural hospitals across the country. You can compare by region, you can compare by hospital type, critical access hospital. And they're really great reports for sharing with your board or just internally. And you will get access to that past your program here, 1 to 2 years, I believe you will still have access to this tool. Okay, so I've told you a little bit about our 3 levels of support and some of our technical assistance. So now let's talk about how you can become one of our hospitals. The application portal is not open yet, but it will open June 1st, and it will remain open until July 30th. We reopen the portal every year, so we have a new cohort of hospitals each year. This is our 5th year to open the portal. So while you can't submit an application yet, you can go out to our website and go to the application portal and click on PDF application. There you can download a PDF of the upcoming application, which would allow you to go ahead and take a look at the questions and maybe get a jump start on filling it out. And I'm about to walk you through it in just a moment to kind of help you understand the questions. But first, just a little bit of information on your eligibility to participate in the Vulnerable Rural Hospital Assistance Program. You must meet one of our 2 criteria to participate. So you must be a hospital, or you were a hospital, and you must be considered rural. So all critical access hospitals are rural and eligible. If you're a PPS hospital and defined as rural by federal or state guidelines, then you can participate. And any tribe or tribal organization that's rural is able to participate. If you're unsure and you want to confirm, you can use FORP's eligibility analyzer, and that is on our website. If you go to the application portal, you can click on our FAQs, and there you will find FORP's eligibility analyzer. There is some exclusion criteria. So if you were already participating in a HRSA-funded in-depth TA program, so if you're participating in a Delta Region Health Systems TA or the Small Rural Hospital Transitions Program, you are not eligible to apply. If you are Flex or SHIP, you are eligible to work with us. So again, if you're applying for Delta or SHIRT and you want to apply for this program, please go ahead. We work with HRSA and we'll do our due diligence to ensure you're not in both programs. So while you may apply for both, you will only be participating in one. Anyone can submit the application on your behalf. A grant writer could submit on your behalf. I believe ASOR even submitted for a hospital in past years. So please reach out to your friends if you're busy and you need some help with your application. We are also happy to take your paper copy and submit it for you if you like. You can submit an application and participate in multiple years. So we have several hospitals who've participated in past years and really thoroughly enjoyed it and gotten something out of new resources each year. So let's just jump right in there. This is a breakdown of our application and how it's weighted. So when we evaluate your application, we look at 4 sections and assign a point value. So if you look at the first 4 lines, the first 4 rows, we look at the health of your community or facility level of readiness to participate, your level of vulnerability, and we also consider distance to nearby health access. And then the last 3 rows are just a couple of things we want to draw your attention to. So let me just jump right in. Okay, our first section is the health of community, which is worth 15 out of 100 points. So this is just basic demographics, name, contact information, who's going to get the notifications about your application. We ask about type of hospital, size of hospital, population of your community, and things like that. We want to know if you're shrinking or growing, average income and age of the community and your industry, just giving us an idea of what's going on in your community. And then our next section, community facility level of readiness to participate. So this is worth 20 points. And we kind of gauge here an interest in your willingness or readiness to participate in our program. So we ask about your hospital board and the education they are required to receive it, what that looks like. Any concerns that you might have. We ask for a description of the community's perception of your hospital. So basically, we just want to get a feel for how much you would engage and work with the program. While there are types of passive opportunities like the webinars maybe to engage in our program, the overwhelming majority of it requires active participation. So that's what we're looking for. The next section is level of vulnerability, which is 50 points. So it's our highest weighted category. So we're going to look at your financial metrics. So we ask for, I believe we've got 5 things listed here. And in fact, we've added one more that's not on the presentation regarding debt. And so we'll update that before you get a chance to download the application, unless you've already done it. And we also look at any extenuating circumstances. So we understand that numbers don't tell the whole story. Have there been any changes in your hospital's administration or leadership that impact what's going on with your hospital? We want to know about turnover rate. We understand what's going on with turnover right now, but we just want to get a full picture of what's going on and any exceptional impacts on your hospital's performance or sustainability. Basically, we want you to share your story with us. So next, we're going to look at distance from the applicant community to the next nearest hospital access. So this is worth 15 points, and we just want to get a feel for where you are and what lies around you. So we ask about the nearest 3 nearest facilities of similar or larger size to you, and we ask about out-migration if you're tracking that as well. This just gives us a sense of where you are and what options are available to your facility. Okay, so next is kind of the fun part. We ask about your priority concerns or your interests. So here we ask you to check 3 of your top priorities that you would like to focus on during your participation year at the Corps. You can fill in the blank and choose other if you like. And you are not married to these 3. If you decide to change your mind or you decide you're going to use a different resource for one of your topics, that's completely fine. These are kind of fluid. They do sometimes change. If they're addressed and you're confident in what you're getting for marketing for say, you might want to talk to us later in the year about another opportunity or interest. 3 is not the limit. It's just kind of a manageable number of opportunities of priorities that we can look at with you at the start of the program. We also ask, and it's not listed on this slide, but we also ask you to provide a brief narrative describing the focus area that you've selected and the technical assistance that you need for your organization. So if you select marketing, that can mean a whole slew of things. So what exactly do you need in the world of marketing? And so that's one of the questions as well. We also ask you to go through a couple of FYI things at the bottom of our application. So your hospital identification, like we touched on up on the slide with the blue map. If you are selected to participate, we love to put a press release out there and just tell the world how excited we are to work with you, but we do understand that sometimes for different reasons you may not want to be identified. So if that's the case, we ask how you do want to be identified. We also ask you to read our commitment for participation. So if you're selected, active participation by your administrative leadership team is really crucial. It's great when a grant writer applies and thinks that the support that we're going to provide will be really beneficial to the hospital, but without the C-suite buy-in and the administrative leadership buy-in, it's really not as effective. And so that we really just ask that your leadership know of the program and agree to participate. And these bullet points are just the different things that I've gone over: webinars, echoes, the case management calls, participation in our evaluation surveys, and our end of the year exit survey. We do have several surveys that we ask you to fill out throughout the year, but they're really short surveys. They don't take a lot of time, and they really help guide whether or not we bring those resources back and how we might change them to make them most beneficial for you and for your other colleague hospitals. So next steps. The application portal opens June 1st and closes at the end of July. So you have 2 months to get your application in. If you are selected, even if you're not selected, you will be notified in August, and the cohort year for year 5 will start September the 1st and run for a full 12 months. I have linked you to our website and our social media account. So if you want to kind of stay up to date on what's going on, those are 2 great resources. If you have questions, please don't hesitate to reach out to us. We're happy to help you with the application or answer questions about our technical assistance, or really just anything. And we're really excited about the upcoming year. We hope that we see an application from you, and I am going to open it up to any questions that you might have. I also want to check the chat because I see a few things posted. Okay. No specific questions. Yes, we are recording. We will post this to the core website and to our YouTube channel. But if you do have any questions, I encourage you to either drop them in the chat right now or feel free to unmute. I'm going to go ahead and stop the recording.